Good afternoon to everyone, and welcome to our webinar series on expanding the scope of research on planetary health in Europe. I am Cristina O'Callaghan Bordo. I'm an associate professor at UOC, Universitat Oberta de Catalunya, and an associate researcher at ISGlobal. I'm sharing this session with Marina Erola, CEO of the Payat Hammam Hospital District in Lahti, Finland. This series of seminars is part of the Severo Ochoa strategic program at ISGlobal and has been jointly organized by the Finnish Institute on Health and Welfare, the Center on Climate Change and Planetary Health of the London School of Hygiene and Tropical Medicine, and ISGlobal. These series of webinars have been running for the last 5 weeks. We started by providing an overview on planetary health as an emerging framework that connects human health and the health of the planet. Then we followed by 3 seminars covering 3 main areas, which are food systems, energy, decarbonization, and sustainable urban development. And today we finish with a session on catalyzing demand on planetary health in Europe, in which we will explore the future and the needed steps to move research and policy on planetary health forward. I give now the floor to Marina Erola, who will present today's speakers. Marina, we cannot hear you.
Okay, sorry.
Try now. Okay, thank you, Marina.
Okay, so good afternoon, everyone. It's an honor to be here again, co-chairing this session. And we are really talking about catalyzing demand for planetary health in Europe. And it's a really great pleasure to me to see that so many countries have joined this European level action, because we certainly need not only European but global level of action on this very urgent and important issue. So climate is actually changing, and we need to act therefore, and we need to act fast, and we need to act promptly. So today we are to hear very nice presentations on this, and then we have a lot of time to discuss also together, since we have 2 panel sessions also included in the program. And the first speaker of today is going to be Natalia Kurek from the UK, NHS Strategy to Carbon Neutral Health Systems. So please, Natalia, it's your turn.
Thank you very much, Marina. Let me just share my screen. Is that visible for everybody?
Yeah, this is okay.
Natalia, we can see it.
Brilliant. So thank you very much for having me here today. I'm delighted to be joining you to speak about the UK NHS strategy to carbon neutral health systems. So my name is Natalia, and I am the Senior Clinical Lead for the Greener NHS programme. So I firstly wanted to start with just letting you all know who the Greener NHS team are and where we started from, really. A team was set up at the NHS to work on climate change and health in the UK back in 2008, and that was known as the Sustainable Development Unit, and it was created as a response to the Climate Change Act of 2008. Since then, the NHS set out a long-term plan, and there was a clear ambition in there included to reduce the environmental impact of the health system. So in January 2020, last year, we launched the Greener NHS programme, and it was launched to take forward sustainability across the NHS. And the team supports the executive board to set the direction for a greener NHS across the health and care system. Last year, we are lucky enough to have Dr. Nick Watts be appointed as the first ever Chief Sustainability of the NHS. I don't need to say to anyone here on the call today, why we need a greener NHS. The health emergency, the climate emergency is a health emergency, and by tackling it, we will reduce causes of ill health. The NHS in England is responsible alone for an estimated 4% of the country's carbon footprint. And with 1.3 million staff, we really do have a huge opportunity to make a difference. Reaching the UK's ambitions under the Paris Climate Change Agreement could see over 5,700 lives saved every year from improved air quality, 38,000 lives saved every year from a more physically active population, and over 100,000 lives saved every year from healthier diets. So back in, as I mentioned, January 2020 last year, we launched the Greener NHS programme. And what we committed to at the time was that we would work on focusing on finding a target date for us to reach net zero. And in October last year, so October 2020, we were fortunate enough to get to the point that we published the Delivering a Net Zero National Health Service report, which set out a credible and ambitious target for us to reach net zero. And by doing so, made us the first healthcare system in the world to set out a plan like this. So just touching briefly on the process and how we got to that moment. So back in January last year, we set up a net zero expert panel, the broad membership across the NHS, wider health sector and external expertise. We opened up a call for evidence to the health system and beyond, an international call for evidence, and we received over 650 submissions. And we use these submissions to support us with our analytics. And what we also did was review the carbon footprint model and made amendments and rebaseline to 1990 to allow for better comparison with the Climate Change Act. We also conducted workstream analyses on specific areas such as estates and facilities, transport, medicines, the supply chain, the non-medicine supply chain, and models of care. So let me just briefly talk us through this slide. So this shows the carbon footprint of the National Health Service in the UK. So on the left-hand side here, we have what we call the NHS carbon footprint. And these are the emissions that the health service have direct control over. And what we've got on the right-hand side, encompassing scopes 1, 2, 3, and travel, is our NHS carbon footprint plus. So the areas that the NHS has a wider influence over, including our supply chain. And moving us onto the next slide. This slide demonstrates the sources of carbon emission by proportion and really shows that there's a huge amount of work to be done within the medicines and chemicals area within the health service, medical equipment, the supply chain, and building energy. And what the diagram on the right-hand side shows is the sources of carbon emissions by activity type and setting of care. And what it clearly demonstrates is that the acute care is showing here the greatest carbon emissions. However, there is action to be taken across all settings of care. So let me briefly touch on how we modeled and how we got to our net zero targets. So if I talk us through this slide very briefly, the red dotted line here at the top is a projection of us reaching net zero if we did absolutely nothing. And the line below, the blue dotted line, shows us what the expected trajectory we would see if we just followed expected national and international policy and action and existing NHS policy. And through our modelling, what we managed to do was to follow this black dotted line here at the bottom, which takes us to 2040. And what the blue wedges here show are areas of policy action and that if we acted in these policy areas could help us to get to a lower baseline here. So potential impacts of further NHS actions. And as you can see clearly here, this trajectory takes us to 2040. So this is for our NHS carbon footprint. So taking that modelling into account, we managed to get to an ambitious and credible target of 2040 for our net zero carbon footprint and 2045 for our carbon footprint plus, both which are more ambitious than the UK government's CCA target of 2050. We've also introduced some interim targets, as we appreciate that 2040 and 2045 are a long way off, and we do need to have something to reach for sooner than that. And what the table below shows is it just touches on the percentage reduction that we've seen, so progress to date since 1990, both for our carbon footprint and the carbon footprint plus. So I've spoken a little bit about the modelling and about our net zero commitments. And what I wanted to take a moment to discuss now was some of the highlighted interventions that we address in the report. And the Greener NHS programme itself, the Net Zero programme, is split up into a number of work streams covering these big areas. So estates and facilities, travel and transport, supply chain and medicines. And within each of these we have highlighted some key interventions that we want to see within the system. And there's also a lot of further work going on behind these interventions. So for example, estates and facilities, as we saw on the graph previously, a huge source of carbon emissions. And one of the big highlighted interventions that we're looking at is part of a hospital infrastructure plan in the United Kingdom. And this is the building of 40 new net zero hospitals that will follow a net zero carbon standard. And they will also be digitally flexible to be able to support the delivery of future models of care. As part of that, we'll also see a huge upgrade to our heating and lighting, completing a £50 million LED lighting replacement programme, which we envision, if it's expanded across the whole of the NHS, could improve patient comfort and save over £3 billion during the coming decades. Another huge area that we saw on the charts before was travel and transport. And we're working closely with colleagues across the organisation to increase active travel for both patients and staff where appropriate, to transition the whole fleet, so the emergency fleet and also the non-emergency fleet, to zero emission vehicles. And as part of this, we want to lead the world with the testing of a first of its kind zero emissions emergency ambulance in the UK by 2022. An ambitious target, but one that we hope that we can deliver on. And then moving on to the supply chain. So we clearly saw the huge contribution that the supply chain has, both the medicine supply chain and the non-medicine supply chain has to our carbon emissions. And in the report, we set out a really ambitious target that by 2030, the NHS will no longer purchase from suppliers that do not meet or exceed our commitment to net zero. So we have over 80,000 suppliers that supply the NHS. So this is a huge amount of work engaging with each of these suppliers and ensuring that they can meet or exceed our own commitment. And a huge amount can be done in steps, ensuring that these organisations are part of the Carbon Disclosure Project and are disclosing their carbon emissions. And also medicines, a huge amount of our carbon emissions are our medicines, mainly our anaesthetic gases and inhalers. They're the two areas that we are focusing on. And with these two focus areas, these two big emitters, we're working with patients, clinicians and industry to help reduce emissions by reducing waste, ensuring that the right medicines are available, the right choices, the right options are made available for patients, and enabling a shared informed decision-making process. I'll just briefly touch on a couple of other areas that we're working on. Of course, as I mentioned before, we have 1.3 million staff. We cannot do any of this work without mobilising, informing and upskilling our workforce. So this is by providing mandatory training, by providing training to staff. Our allied health professionals are working themselves on what a green allied health professional looks like. There are a number of pockets of work, but we really do need the whole 1.3 million staff to be on board. and we're also very aware of the role that innovation plays and the potential that future net zero horizon scanning has to help us identify the future pipeline of innovations across all of these work streams. And also, of course, food and nutrition. And what we are doing is collaborating with catering leads across the health service and dietitian suppliers to ensure that we are providing healthier, locally sourced food for patients, staff, and visitors. And of course, these are the big action areas, but there's a huge opportunity also for carbon reduction through embedding sustainable approaches in the way that we design and deliver and develop care across the whole system. So what we mean by this is using sustainability as an additional factor in care design, for example, alongside quality improvement principles. None of these principles are new, so we see already that they improve patient experience by having care closer to home, earlier, quicker detection and diagnosis and treatment of patients, ensuring that we're embedding the best clinical practice for patients, and treating for the long term. So none of these are new principles, but all of these have the opportunity of seeing carbon savings, and these will mainly come from things such as reduced presentations to A&E, primary care, outpatients, reduced staff and patient mileage, reduced bed days, fewer pharmaceuticals prescribed, and less intensive procedures. And as part of this, there's also the component of embedding digital technology into how we deliver care. And that fits into each of the categories and the principles that I've just mentioned. And we see the huge role that this and the huge potential savings that digital technology has had on the system as a result of the pandemic. So we really want to ensure that we continue with these sustained co-benefits. And we also need to tackle ill health from a prevention perspective, and also ensuring we are tackling health inequalities more broadly in the community. So just to finish off, that was a whistle-stop tour through what we are doing at the National Health Service in the UK. But with the UK government hosting the UN Climate Change Conference in Glasgow in this year, the NHS is very well placed to contribute and be shown as a case study to support other health systems in their decarbonisation journey. So our focus over the next few months is to continue engaging with our staff, our patients, and more widely to ensure that the health services commitments on climate change and net zero are clear to the world, and also that our staff are engaged with the process. We also plan to publish a number of delivery reports, which will be a kind of a step-by-step guide really for some of those key areas that I mentioned, and give slightly more detail as to how to achieve some of the ambitious targets. And also not forget adaptation and the importance of adaptation. So we have a report soon to be published on the health and social care sector, climate change adaptation. So that's it from me. Thank you very much. And thank you again, Marina.
Many thanks, Natalia. Very nice presentation. We move now to Marina Erola, who will present the Finnish approach to planetary health. Marina, the floor is yours.
Okay, can you see my presentation now well?
We can see your presentation, but we cannot see you. Okay, now we see you. Yeah.
Okay,
excellent.
Now you see both. Okay.
Yeah. Go ahead, Marina. Thank
So
you.
now you see a Finn presenting the Finnish approach to planetary health. Okay, so I'm just going to talk a little bit about the principles, how we have been planning the planetary approach in Finland, in Helsinki, and then I'm going to give an example of a local pilot which we are just to introduce here in Lahti region, where I'm currently working nowadays. So we have been putting this presentation up together with THL, with especially Professor Jana Halonen from THL, who is working there as a research coordinator and who has been very active from the beginning of this planetary health approach for Finland. So she might be also able to ask some of the questions because she is also here in in the background today. So can I have the next slide, because it seems it's not moving from here. Adriana, can you take the next slide, because it's not.
Yeah, but
okay.
no, yeah.
Okay, now maybe it's now working, we'll see. So the Finnish approach for planetary health, and actually for many public actions we are doing, is based on 4 main principles. This picture is taken from the area where I'm living. It's one of our famous places here, and it's also quite representative of the landscape and the nature in Finland. In this activity, we want to be promoting science, because it's very important that we have more science, and also especially when we are talking about Finland, it's extremely important for us that we are interlinking with the leading European countries in making science for planetary health. We have, for example, a variety of funding instruments available in EU, but Finland is not really big enough to manage in those calls without linking very well with the international partners. So this is one of the reasons, I think, why we are here today. Finland is quite good in making all kinds of governmental reforms and legislative reforms especially. We have a very big ongoing reform in relation to health and social care going on. It has been planned for 16 years, I think now, and I think it's about to be finalized. So I think that we will have a whole new legislative basis for social and healthcare, probably starting next fall, unless there will be some political problems, which there actually has been very, very often. So this planetary health approach is also built under many legislative reforms, not only reforms from health and social care, but also other current reforms on which the government is working on. We have been doing in Finland very much large-scale community-based health programs. The most famous one of those is probably the North Karelia project, which has been going on for tens of years already, and it's quite well known. And we are using still some of the main principles we used at that time. And one of them is that we want to be introducing local pilots first, then we see how the local pilots are going in terms of these programs, and then we are scaling them up quite rigorously, and then we have the nationwide movement going on, and then we just keep rolling out that nationwide movement. Also, we have been focusing on quite a lot in raising public awareness on the issues that we find of importance, such as this planetary health concept is now, and this shall be also done in relation to the planetary health concept. The aim of the Finnish government is socially, economically, and ecological sustainable Finland by 2030. And naturally, we are also supporting the UN Sustainable Development Goals. We have an update of the Climate Change Act. It's ongoing, and it should be, I think it should be finalized by 2021. I think Jana will know more than I about this. And then we have the National Climate Change Adaptation Plan, of which we have the midterm evaluation conducted 2020 already. As I mentioned in the beginning, it's very important for Finland to be promoting science very strongly, and we need more funding for planetary health related strategic research. And actually there has already been many new funding opportunities to finance funding in relation to this kind of scientific activities. We have several programs that fit quite well with these activities. We have the Climate Neutral and Resource Scarce Finland. We have Keys to Sustainable Growth. We have Towards a Sustainable, Healthy and Climate Neutral Food Systems. And we have thus a lot of action on the Finnish Academy on system level research, and especially also on system level research on climate change mitigation and adaptation. And this is naturally very good because without this funding, we are not able to go on with these activities. And especially it's very important for us to have also national seed funding in order to be able to improve capacity to succeed in EU funding instruments. In my previous work in THL, I was responsible of the THL research activities, and I was going through quite in details, for example, the Horizon Europe program. And actually, as you all know, there's a lot of funding opportunities there in the future, also in the Horizon program. Then how do we raise public awareness on the issues? First of all, it's actually quite important to have the correct and the adequate national stakeholders involved from the very beginning. And this doesn't mean only research community, but it also needs like big cities and also smaller cities and NGOs and many other actors that we really need to gather together in order to have the critical mass of newly thinking people. Once we have the critical mass of newly thinking people, then things start to roll and we actually are able to have some changes in the public opinion. For this reason, we have also many forums. One of them is the Science Forum, which is a biennial science festival that is open to all visitors, and the planetary health theme was presented there in 2021. Then we had quite a unique activity, which was the Helsinki Declaration to protect human and planetary health for 2020. And many of you, I think there, at least some of you were there present in this conference. It was actually conducted as a part of Finland EU presidency activities. And we summarized what are the main principles of the Helsinki Declaration in this picture. So we are talking both about human health and also the health of the planet, because these interact. What is good for human health is usually also good for planetary health. We talk a lot about equality in Finland when we are planning actions. We are usually building action-oriented programs, and we usually start by defining the long-term goals quite well. Then we have short-term actions, interventions, and then very much impact-oriented action. And this is the basis how actually the majority of the Finnish public health programs, especially those related to the respiratory diseases, have been conducted out, and actually the results have been quite good. So less talking, more doing, enough science and very rigorous goals, and then active evaluation of the activities. We are introducing local pilots and then scaling them up, and I'm just showing one local pilot, which we are just to start introducing, and this is called Lahti Plan. The plan will start realizing from 2021. It will be a 10 years plan. Actually, there's a wrong number here. It should be actually 33, so it will be a 10-year plan. Lahti is a medium-sized Finnish city. I think it's the 8th biggest city in Finland at the time being. Lahti and its surrounding municipalities has a population of about 200,000 people. And this is a quite average type of a city where the Europeans are also living. So it's quite representative for an average-sized European city. Lahti is the European Green Capital for this year, and Lahti actually applied for 3 times for this nomination and finally got it, and has done very remarkable work in terms of reduction of CO2 emissions, and it has been having also a lot of work done to rescue one of our biggest lakes here around Lahti, which is called the Lake Vesijärvi, which was actually just going to die out, but with very prompt and massive action, we managed to save that lake. And there's also a variety of other things that actually led to the nomination of us, of Lahti to be the European Green Capital. And now, during this year, we are going to have a variety of actions in relation to this. And now they are mainly held as webinars, but maybe in the fall, we manage to have also some real life happenings if we manage with these pandemics. Lahti will be carbon neutral by 2025, or at least that is the very ambitious goal for us. So what will the Lahti plan be like? It will be an educational and communicational program, which is based on the experiences we have had in planning and running public health programs in the country for actually 25 years or so. For respiratory diseases, we have had 25 years of history of very strong programs, starting from tuberculosis, and now the latest program we are having at the time being is the program for inner air programs, and we are using the experiences we take from there. It arises from the interconnected crises, so climate change, biodiversity loss, and increase of both communicable infectious and non-communicable diseases. And we have realized that actually these two things go together, and with same kind of actions, we can both be doing good for the planet and also good for human health. And once we have the health professionals, as was quite nicely already reported from NHS, and also the community people coming together, then we manage to raise new kind of energy towards these planetary health activities. So it's thus extremely important, for example, to have the doctors also taking active participation in this. The program aims to combine the public health and environmental goals in one single program. We are aiming to create a model which can be scaled up for other EU cities, especially for the cities which are of the similar size, more or less, but also for bigger cities, easier probably to start with little bit smaller cities. And naturally, multidisciplinary research and education are included. And we have a planetary health conference in this year in November in Lahti, Finland. We hope to have it as a live conference, but we will see then how it will go. And there we will announce the program in details. The Lahti plan has been is being put together with City of Lahti, Green Lahti, Päijät-Häme Joint Authority for Health and Wellbeing, which I'm the CEO at the time being, and the Finnish Institute for Health and Welfare, Natural Resources Institute Finland, Finnish Environmental Institute, University of Helsinki, and the World Federation for climate also. So this was my presentation today. Thank you very much. And I think we can go on with the program. Thank you.
Okay, thank you, Marina, for this inspiring talk. We give the floor now to Maria Westerbos, who will present an innovative solutions to reduce the problems that plastic generates in the environment and for our health. Thank you, Maria. Maria, we can see this presentation, but we cannot see you and we cannot hear you.
Something went wrong. I'm going to do it again. Sorry.
Okay, now.
Here. Yes.
I saw you for a few seconds.
Yeah, thank you.
Okay, perfect, great.
It's going better, is it? And then give me 1 second to have this, no, and now go back to first. There we are. Sorry
Excellent.
for that. Sorry all there. Good afternoon to you all. I'm a little bit I'm not very well on the internet, as you saw, so that's a bad introduction of myself. On the other hand, I am Maria Westerbos, director and founder of Plastic Soup Foundation since February 2011. And we aspire a world with less plastic for a healthy planet and humanity for the next generation. And let me be clear, climate change and plastic are on the same destructive page. To reach this goal, we focus since a couple of years. Whoa, he is so eager, Paul Rose. To reach this goal, we focus since a couple of years on plastic and human health. Please have a look at this clip. And now I give him the floor. Besides this channel, we also organize plastic health summits, and the first one took place in October 2019. We reached more than 600 million people worldwide. The second one will be on October 22 in Amsterdam again. And please have a look at the text on the screen. If you think the economy is more important than the environment, try holding your breath while counting your money. The second one will be, as I said, on October 22 in Amsterdam. Please subscribe if you want to come. The biggest problem for the environment, animal life, and our own health is the smallest, micro and nano plastics. In 2012, we started campaigning against the use of microbeads and microplastics in everyday products. In 2015, we came across a list of only 67, it's going too fast. In 2050, we came across a list of only 67 microplastics ingredients to be aware of. Today, we are aware of more than 500 ingredients widely used in personal care products. Some of these ingredients indicate toxicity to human health, some to aquatic life. All this information can be quite daunting. That's why we created an app, which is already downloaded 350,000 times. This app can read in a split second the ingredients that are listed on a product. From now on, the truth is on the back. It's like a traffic light, red, orange, green, zero. Red means this product contains microplastic ingredients, and we advise you to not buy it. The zero is the opposite. Brands on the list have their entire range of products free of all known 500 microplastic ingredients, and for that they may carry our Zero Plastic Inside logo. Already over 100 brands worldwide are awarded with the zero, and we expect to have over 200 at the end of 2021. A second campaign of Plastic Soup Foundation is Ocean Clean Wash. It all started in 2014 with 3 years of research funded by the European Union. How much micro and nanofibers do synthetic clothes shed in the washing machine? As you can see, we were the dissemination partner. The astonishing result, every 5 kilograms washed, your synthetic clothes lose 9 million very tiny fibers. Water retreatment systems do not filter these out. You can compare that, by the way, with the 750,000 fibers Thompson from Plymouth University found approximately around the same time, only it's a matter of weighing the filters, the fibers, and in our particular case, it was counting the fibers, and if you weigh them, it's approximately the same amount of fibers Thompson found. There were, I could better say, 2 billion washing machines already in 2010, and there will be 5 billion washing machines in 2050. 65% of our clothes is already made from plastic yarn. And to be clear, we drink, eat, and breathe our own clothes in. And the first proof of that was delivered very recently, and we made an episode on the Plastic Health channel about that by scientists from the University of Groningen and scientists in America. And the most important conclusion is that inhaling microplastics from textiles, because they are in the air also, that might damage our lung cells, especially when people suffer from COVID, or when you're very young and your lungs are not completely developed yet. I think that is a scary conclusion. So let's see how much solutions there are, because there are solutions which are not all implemented yet, because fashion industry is really huge and it's very difficult to change course when you are that big. The first thing is improvement of the yarn. We already know that woven yarn is better than knitted yarn, and that the length of the yarn is also important. Adding a biodegradable coating, there is already a biodegradable coating up to that protects clothes up to 50%, but almost nobody is using it yet. Industrial pre-washing, we as Plastic Soup Foundation work with Planet Care from Slovenia, and they developed huge industrial filters that you can place when you have a hotel or whatever, or make a lot of clothes, to pre-wash your clothes 5 times before you sell them, and the loss of fibers will be much less. Development and installation of the same filters in domestic washing machines. You can attach them and it's easily done. And in-store awareness campaigns, of course. Furthermore, we also, and if you want to read more, by the way, go to oceancleanwash.org. We are also involved in the development of a scientific standard for microfiber release. Fashion and textile brands can get their clothes tested with this new, and it's really new, methodology and benchmark. This standard is an initiative of the Wear of Microfiber Alliance. And of course, we are part of that. So, should we be worried? I would say, let's have a look. It's not working. I'm sorry for that. So, no, it's not working. I'm very sorry for that. So let's then just finish my talk. And we can always start vacuum the sea and the beach. Thank you.
Okay.
Thank you.
Okay, thank you very much, Maria, from a very nice presentation. I mean, even though some technical problems in the last, it was still a very, very interesting and nicely put up presentation. So we are now moving to the next presentation, and then we discuss also Maria's presentation during the panel discussion time. And the next speaker will be Jenon K. Jensen from Health and Environment Alliance, HEAL.
Thank you, Marina, and welcome everybody. I have Adriana who's going to put up my slides. Thank you. I can see them. Does it sound okay for you all, Marina?
Yeah. Yes, we can hear you very well.
Great. So yes, my name is Jenon Jensen, and I'm the founder and executive director of the Health and Environment Alliance, also known as HEAL, which was started in 2003, almost 20 years ago, to support a healthy planet for healthy people and healing our planet and our health have been kind of our mission. So next slide, please. Yes, I wanted to say a few words about who HEAL is for those of you don't know the organization. We are an international not-for-profit, non-governmental organization that actually is membership-based, and we have 90 organizations in 28 countries who make part of HEAL. That shows you on the right the level of the different types of people, constituencies within our organization, and it's a very broad and diverse church, and it also brings together both European, national, and local organizations. And next slide, please. Oh, yes, here. Okay, I guess, yes. And I wanted just to share part of our mission, which I think is really important today as we talk about strengthening the links between research, communication, and advocacy. Is one of our missions is to ensure that health evidence and health voices are heard by politicians and policymakers in Europe and beyond, to protect those most harmed by pollution, such as the fetus, children, pregnant women, and the elderly, and those living with existing health problems or conditions, or especially exposed polluted environments. So with that context, go to the next slide. Like to give you just as a network, we also work with a lot of partners in Europe and globally. At the top of the slide, you see some of our leading European network members, whether it's the European Respiratory Society, the European Cancer Leagues, or AIM, the international not-for-profit health insurers. And the exciting thing with working with our European network members on planetary health and environment and health is that they are also able to leverage the work of HEAL and amplify it through their national members and constituencies. Some of our partners are the Global Climate and Health Alliance, which many of you may know, and HEAL is proudly a founding member organization. We also work with both the World Medical Association and the European Committee of Doctors, and the Green 10, which is a group of the largest environmental NGOs working at EU level. Two of the campaigns that we're particularly involved in is Europe Beyond Coal, where we are one of the only health stakeholders and members, and the EDC Free Europe campaign, which works on stopping and changing our exposure to hormone disrupting chemicals, where HEAL provides the secretariat. And lastly, FIGO, which is the Federation of International Gynecologists and Obstetrics, and we have been working with them for many years. And lastly, which I think is interesting and a nice context into my presentation, is that over the years, we have really put an emphasis on the science to policy translation. And in this context, at the moment, we are a member of the CUSH, which is working on sustainable cities. Also, the EU-funded research projects, Athlete, which is looking at early life exposure and the exposome, Freya project, which is looking at EDCs and female reproductive health, and lastly, HERA, which you're going to hear later about in this project. And I think it's exciting as an organization to be very much a partner in these research projects and working on the communication, dissemination, and policy relevance of the research. Next slide, please. So I would like to speak to you today about 3 recommendations to take away on how we think impact can be increased from current and future researchers, and how scientific and scientific communities can contribute to this, and have a very important role to play. So one of them is working with NGOs to relay the science to policymakers. Secondly is inserting the science for policy milestones at key policy junctures. And thirdly is being clear about the cost of inaction, as well as the benefits of environmental, climate, and anti-pollution measures. Next slide. So the first topic is working with NGOs to relay the science to policymakers. And what I would like to do here is, next slide, is just give a few examples to illustrate this point. And the first one on the left-hand side is very recent, from just about a week ago, where Heal was very privileged to be able to host a conversation with Dr. Shauna Swan on the release of her new book called Countdown: How the Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Development, and Imperiling the Future of the Human Race. And this was the second time we've worked with her. We brought her to the European Parliament in 2012, I believe, to talk about EDCs and how chemicals are impacting reproductive health. Now today, she has put this together into a book which brings together over 25 years of research and has some very bleak findings, but at the same time, what is exciting and what we did with bringing her to this webinar, which now is available on YouTube, we invited policymakers and journalists and health clinicians to participate, and we framed it around the European Chemical Strategy for Sustainability as an opportunity to change these findings and this trajectory that she has described, which possibly, according to her hypothesis, looking at how fertility, sperm fertility is decreasing 1% a year, that by 2045, we could be in a situation where we have zero fertility. The second example I'd like to highlight, and the way that we are working with scientists and research, is bringing their findings through webinars, through events, and here on the right-hand side is through information releases and press releases. So here, what we are often doing is when a new study comes out in a peer-reviewed journal, we get a heads up from the authors, or we see it see it coming out, and we think, this is very interesting. We can't just send the study to policymakers. So we do an information release where we highlight the study and we connect it to the policy opportunities for prevention. And this one focuses on the association between early life pregnancy, PFOA exposure, and the increased risk of miscarriage during the first trimester. On the bottom of the slide, you see 2 examples from our climate change and health program and air quality. On the left is Dr. Maria Nero, who I'm sure many of you know on this call, on this webinar, who has been a very strong partner, and WHO in general, in providing the evidence that we are able to use and share with policymakers. And this particular one was 2018. Maria came to Brussels. she highlighted some of the information from WHO on air quality, and it was just before the Commission was about to start an infringement on air quality for member states who hadn't respected air quality guidelines. The second example over on the right is we've been working over the years very closely with the Lancet Countdown and doing briefings and joint events. This one was with the Standing Committee of European Doctors. And what is, I think, our role in this is to take the science that's provided in this countdown, to get it out to our constituencies, to bring it to different EU institutional players, and also to promote it through our very impactful social media channels. Next slide, please. So the second recommendation I'd like to talk about is how important it is to insert the science for policy milestones and at key policy junctures. Next slide. So with this slide, what I wanted to show is that the process for adopting or revising an EU law is very clear from the beginning. And because it's clear from the beginning, it also means that the opportunities for inserting the science or for bringing your research are also very clear. And here is where HEAL is working very hard to follow and communicate these key policy junctures of the files that we are prioritizing within this decision-making process, whether it is responding to a public consultation. We just had one on air quality, and we're going to have another one on the sustainable use of pesticides directive that will be taking place from the EU, or whether it's through providing input into stakeholder forums, or also providing evidence to, before European parliamentary votes, or when there are Environment Council decisions or conclusions. Next slide. So the example I would like to use here is one example that is old and at the same time very recent. And this is our work around, we have a health and chemicals program and pesticide, reducing our dependency on pesticides, and the impact on people, communities, and farmers has been at the core of HEAL's work since our existence. On the left, you see a poster that we put together based on a science that came out, a study that came out from Philippe Grandjean on how one in every 6 children have a developmental disability, in most cases affecting the nervous system. And one of the chemicals that's listed in this study is chlorpyrifos. And the most recent work we have done on chlorpyrifos is initiating a campaign to ban chlorpyrifos from 2017 to 2019, when the dossier for this pesticide was up for renewal. And to begin with, we brought the science in our submission for the actual consultation. So there's often you can provide science as a stakeholder. Industry is very active on that, also many member states. And then once we had done that, we brought the most recent science and scientists in a science webinar series. And here we were able to record this, and we had policymakers from the European Food Safety Agency at this webinar series who were very happy to have that opportunity to hear a presentation, download it, and ask questions directly to the scientists. Then we created a series of infographics which highlighted why we were concerned about chlorpyrifos based on the science that was out there and the facts. Chlorpyrifos is one of the most commonly used pesticides in Europe. There was more than enough studies to show the damaging effects on child brain development and also where it's being used. This was accompanied by an infographic or a petition, an EU-wide petition where we worked with We Move and to get signatures before an important vote in a member state committee that would decide whether they wanted to support the Commission's proposal not to renew chlorpyrifos and its cousin chlorpyrifos methyl. So what is the impact there? The impact is that in 2019, the Commission did and member states adopted this ban on chlorpyrifos and chlorpyrifos methyl. That's the very good news. The not so good news is that in 2020, industry has challenged the renewal of chlorpyrifos methyl in the European Court of Justice. HEAL is decided, given its long-term involvement and its constituencies impacted, to support the Commission's ban and become an intervenant in the actual court case. And we will have more news on this later this year. Next slide, please. The third recommendation I'd like to share with you is being clear about what the cost of inaction is and what the benefits of environment and climate measures can be. Next slide. And here, I'm going to take an example from our Climate, Energy, and Air program. And as many of you know, energy-intensive production has significant health impacts. And in 2013, we commissioned one of the economists who works with the European Commission to put together the first ever economic assessment of coal's impact on health for Europe, which was called the Unpaid Health Bill, How Coal Power Generation Makes Us Sick. And what this report did, you see it here in English, but we also translated it into the other languages where there was a significant amount of coal being used and communities being most affected by this pollution. And we see that the total cost was up to 4.2 billion per year. This was in 2013. This was picked up by the media, by the press, by policymakers, and also it found its way into a book by George Monbiot, How Do We Get Into This Mess?, where he highlights our study and says, do you still reckon that coal is cheap? Following this work, we brought out a second series of reports called Chronic Coal Pollution, this time, again, calculating the cost of our dependence and the impact of coal power generation, where we focused on Europe and also in the Balkans and Turkey, where HEAL has offices. The impact of this work, but of a very large community of NGOs and committed governments and people, is just yesterday, I believe, we're part of the European Beyond Coal campaign, which has a goal to retire all coal power plants by 2030. And just yesterday, they reached the 50% of European coal power plants now retired or announced to retire. So we have some ways to go, but we are at the halfway mark. Next slide, please. So I'd like to conclude with what are the policy opportunities for planetary health at the EU level, because there are many, and many of you, I'm sure, have heard know the EU Green Deal and zero pollution objective that has been committed by this European Commission's term, which ends in 2024. And we believe that this is the opportunity of a lifetime, and it couldn't have come earlier. And what we're really excited about being at this webinar is how we can make sure that the research that's going on out there is being brought in and used to influence how we transform our society, and how to do it the most effective way and with the most benefits for public health. Next slide, please. So just to give you an idea, I'm not going to go through all of these, but these are some of the Green Deal opportunities. And you see they range from climate to energy, mobility, biodiversity, from our food systems, eliminating pollution, and a just transition to make sure that no one is left behind. And this is really our frame and the new frame that we think can make a huge impact of where we want to go. Next slide. Just two examples to leave you with that are two of HEAL's priorities as a network. And the first is the EU Chemical Strategy for Sustainability, which was adopted in November last year. It is really a sea change in how we are going to manage, regulate, and reduce chemical and transform the chemical industry. And there are lots of exciting opportunities. There are 4 annexes, as you see here, where we have PFAS, EDCs. We have a timetable each year, and there will be more proposals coming out each year. And what we're really excited to hear from just last week is that the environment ministers adopted council conclusions on this strategy, asking for speedy implementation to reduce the daily exposure to our chemicals, and fully supporting this strategy that has been brought out by the Commission. On the right-hand side is another opportunity. This time it's revising the EU air quality legislation to bring it in line with the WHO health guidelines. And the challenge here will be whether it's aligned or slightly aligned. And we are really working very hard because WHO has brought out the evidence. They're revising their guidelines this year. And we believe that legislation needs to be based on this science. And we need to see proposals that really bring that to that level. The European Parliament is voting on a resolution tomorrow, which will give direction to what the European Commission brings out on air quality. And we're really excited. Last week, we initiated and launched a petition on clean air for all with We Move, which over the past week has gained over 66,000 signatures. So encouraging you to sign that. It's a real-time effort you can do. And to conclude, just looking forward to answering your questions, but also saying that there's no time to lose. We really need planetary health to be at the center of this policymaking around the Green Deal, and we need researchers and scientific communities to be part of this effort. Thank you.
Okay, thank you very much, Janon, for your very comprehensive and very well put together presentation. And now we have time for a panel, which is going to be led by Christina. Christina, please.
Yes, I will ask at this point to the panelists to open their cameras and mics so we can have a joint discussion. Well, first of all, thank you for these 4 nice very complete presentations. We will have now a 15 minutes panel discussion with some of the questions that have been put by the audience on the chat. And after this panel, we'll continue with another presentation by Manolis Kovivinas, and then followed by another panel discussion. So let's start now. One of the first questions we have is for Natalia. Does the NHS has a plan if the supply chain dealers do not meet the NHS CO2 goals? The person who put this question says, I don't think the NHS will compromise on quality if the specific dealer is not able to meet the goal.
Thank you very much, Christina. So a very interesting question. And I think what we have to say up front is that, our goal at the moment is a commitment to meet or to exceed our ambitions by the end of the decade, so by 2030. So we still have a number of years to work through what this might look like. And what we really don't want to do is to leave small and medium-sized enterprises behind on this journey. So what we are doing in the process is an extensive supplier engagement piece at the moment. And we had a pilot last year which saw 27 suppliers kind of voluntarily share their plans for carbon reduction. And we're expanding that this year to over 500 suppliers. So we're really working through with them in these forums, what this commitment might look like by the end of the decade, taking into account that different suppliers are on different parts of their journey, and therefore not everyone will necessarily be able to meet the targets kind of ahead of time. I think it's difficult to say now what we will do, by 2045, if some of these suppliers are not yet meeting our targets. I think we will find a way of working with those. Obviously, the main priority for the NHS is to deliver high quality care for all, and therefore we will not, as the person asking the question clearly states, we will not compromise on quality in the longer term, because ultimately, the health of our patients is critical. So my answer would be that at the moment we don't necessarily know what the answer to this question is, but we will work very closely with suppliers, especially over this coming year, but definitely over the next decade, to understand and finalize precisely what we mean by meeting or exceeding our commitments.
Okay, thank you, Natalia. I had a similar question regarding the strategy on medicines, but I guess that your answer will be similar. I don't know if you want to add something on that.
So again, very similarly on medicine. So, we are engaging with pharmaceutical companies, we are engaging with patients and with clinicians, and we need to ensure, we very much hear the voices of patients and of clinicians, and something that rightly comes up is, we cannot compromise care. So that's why, again, we're still early on the journey with medicines on this, looking specifically at certain medicines, inhalers, anesthetic gases. But over the coming decade, we'll expand this onto, other medications, and really kind of work through how we can find lower carbon substitutes.
Okay, excellent. Thank you. Marina, do you want to take another question, or shall I continue?
Pardon, did you ask me something?
Yeah, if you want me to read all the questions.
Yeah, please. Yeah, just go ahead. Yeah, I was just reading also through them. But
okay,
yeah.
then I have a question for you from the audience. Okay, Marina, do you have more information about your model or healthy sustainable development for LATI that could share or could be a reference for other cities?
Yeah, sorry, okay. Sorry, I'm not here. Do you hear me now? Because there's some problem with here.
Yeah, we can hear you perfectly.
Okay,
Can you
yeah,
hear me?
Okay, very nice. There's some technical problem. Well, we are actually just starting to put together the LAHTI plan, the 10 years plan. So please come to our seminar or conference or webinar or whatever it will be in November. By that time, we will have the concrete plan, or more or less the concrete plan. As I said, we are using many of the basic principles we have been doing the public health programs in Finland with, and I have Professor Kari Hahtela here, who is a famous, well-known allergologist in Europe. He has been working actively with these programs before, and by that time, by November, we will launch the plan. So at that time, we are more than happy to share.
Okay, and linked to that, I wanted to ask you if you have been already working with other European cities that have already shown an interest on copying or following the LATI model.
Not in this sense, not in the sense of a planetary health program that is putting up together the health professionals and the other professionals, but actually we have been in discussion actually with Joseph that we would be more than willing to start having some pilots with other European cities also, and for example Barcelona, or maybe even a little bit smaller city would be quite good to start with, because it's probably easier to start. So we are just looking for suitable candidates to run maybe some pilots together. That would be very nice, but not yet.
Okay, thank you. I don't know if we lost Maria, because there are a few questions for her, but I don't see her connected now. Well, then I jump to Zenon. What do you think? Do you think the possibilities will be in the? Sorry. What do you think the possibilities will be in the context of the CP26 in Glasgow, the COP26 in Glasgow? Any actions planned? How to efficiently advocate and how to address?
Excellent. Thanks for that question. So yes, this is the really important opportunity, the COP26, which has been postponed, as we know. And how we are planning it here, we've been part of an observer to the UNFCCC for I think about 10 years now. And so we have a health delegation that we take each year. This year, we may not be going in person, but we will definitely be going digitally and joining lots of different movements that are going on, including the Global Climate and Health Alliance, which will probably have a summit. And so that will be a key focus. What kind of actions are planned and how to advocate and who to address? We're working very closely with the WHO Health and Climate Working Group, which are putting together an advocacy kit to help provide local or national groups more capacity to do advocacy vis-a-vis their health ministries. I think this is an important place to be advocating, that we often forget to empower those health ministries, not only to talk about the health harm, but to talk about the wins that we've heard very much from the NHS presentation. So this is how we will be advocating and who to address. And your national governments are very important, as well as the EU, but national governments make up the EU. So I would say bombard them with as much information about the benefits and why we need to move to more ambition in our climate action.
Excellent.
Christina, maybe I could take one question here from the questions, which is, I think, very relevant, and what we are also thinking here also very much is, it has been addressed to all, and it is stated so that I would love to hear how you include healthcare professionals into your plans. And I think this is an extremely good question, and also not only in the policy level of planning, but at concrete level, at community level. How do we involve the practicing physicians, for example? Extremely good question. Does anyone have an answer?
Was that addressed to me? I didn't quite hear.
To all. It's to all. It's addressed to all. The question is addressed to all.
Well, I'd be happy to start it off because health professionals are really, really important. And the way that we're involving them, it's not just, we're looking not only at doctors, but also at nurses, also at health clinicians who are responsible for very vulnerable groups, such as pregnant women, children, midwives. And the way that we are involving them, and I think they can be really important in policy, is bringing their voices, their positions, their experience on what they're seeing on the ground. Just last week, we had a clinician, a researcher and clinician from Spain, Lolo Gomez, talk about what she was seeing in her fertility clinics and giving advice. So I think that health professionals are incredibly respected and important in this debate. So anything we can do, not necessarily to make them so that they are the lead, but bringing them information, highlighting when their voices, when their experience, and how they can get involved, because they have full-time jobs as well, as we all know, and even more now than ever before. Yeah.
If I could come in to follow that.
Yeah, Natalia, what is your suggestion for this?
I have to say, I completely want to echo what John said in terms of, health professionals are such a trusted and health leaders, especially after the pandemic, are such a trusted group of advocates, and we really need to use them and maximize the potential that they have in driving forward the health and climate change agenda. And they have a huge role to play in terms of discussing the co-benefits of health. And I think that's something that we kind of very, very briefly touched on. But, things such as the cleaner air and active transport, better diet, safer births, greener spaces, there's a huge amount there to be to be related both in acute settings, but also in community care and primary care. So yes, and we're seeing a huge amount. And I think what's incredible about the Net Zero report for the NHS is that, despite the pandemic, there really was the motivation within the staff, the 1.3 million staff, to continue on this agenda. And despite everything else that was going on, to push forward and to publish the report in October last year to signify that, this is the next emergency. The climate emergency is the next emergency. And this is why we kind of need to tackle this, and why, staff, healthcare staff, all healthcare professionals need to support this agenda and act as advocates.
Manolis wants to answer to the question.
I'm supposed to talk in a minute, but can I comment here also?
Yes.
We are expecting the public health professional associations and the environmental health to be very active, but in reality, some of the most important groups from the health professionals who have been very efficient in contacting the Commission and promoting changes are some of the clinical organizations. The ERS, the European Respiratory Society, has been really key in terms of air pollution, and they may be the epidemiologists within the ERS, but it is the ERS because they are so much more powerful than the public health association. So when we're thinking about health professionals, we're not talking only about people in the wider public health area, we're talking also about the clinical health professionals.
Yeah, Manolis, I fully agree with that. I'm a pulmonologist myself, and but have been in paperwork, as my children say, for 20 years. But actually, I also find it very important that also the key clinical opinion leaders get involved, because if we don't get them involved, it's quite difficult to get, for example, the other doctors. Easier to get the nurses and the midwives, and so I think it's easier to get them involved, but we also need the doctors. It's quite important to get them involved. Both are needed, but the doctors are especially needed. So I fully agree, Manolis, with your statement.
Okay, thank you. I think we can continue this discussion later, and now jump to a question specific to Maria and her presentation. Maria, someone in the audience asked if you can tell us more about how the Plastic Sub Foundation interacts with academics and policymakers.
Am I good to hear? Because my neighbors started
We can
drilling.
hear you.
We can hear you, yeah, sorry.
The drilling is not bothering you?
Do you want me to repeat the question?
No, I heard the question.
Okay.
What we do is we are in the center of a huge network of universities and scientists worldwide researching the effects of micro and nanoplastics to human health. And what we do is we use press to reach out for huge audiences. So we send out press releases using PR agencies, for example, in London, to make sure that our message goes far, wide and far. And for that, when we do so, we invite politicians in Europe and the United States and the UK to respond on the press release and to bring in their opinion and their vision, and that works very well. Last year we achieved to reach out for more than 2 billion people even, and the estimated readership was again about 700 million people. So we use press, we are communication experts, and that works very well.
Okay, thank you very much. Maybe we should stop the panel discussion here and move to the next presentation.
Okay, so the next speaker will be Manolis Koveginas. I'm not sure if I can pronounce your name. Senior Researcher and Scientific Director of the Severo Ochoa Distinction, Barcelona Institute for Global Health. Please, Manolis.
Thank you, Marina. So what I'm going to do is to present the HERA project, which is a funded by Horizon 2020, and we were asked by the Commission to prepare a midterm plan on gaps in research in the environment and climate in relation to health for the EU, so 2020, 2030, with emphasis on research that could cover policy questions. The next slide. The project is led by Robert Barouki from INSERM, and it's co-led by me, and we have participants from nearly all the big centers on environmental health in the EU. The next slide. So what we did as a first stage was to contact hundreds of researchers and stakeholders in Europe. So this Y-shaped approach. So on your right, we contact a few hundreds of researchers and asked them their priorities, what they thought were the gaps we had in research. What should we do more? And we got their responses, we synthesized them, we evaluated the gaps that were mentioned. We then evaluated the gaps in the gaps. So what was not told, and we did the same thing with stakeholders. We had a consultation group, and we put everything together, and we produced a first analysis and identified also what we call the white spaces, areas where we really have very little research done. For example, biodiversity and health. It is not an area, it's very important. We identified it as a very important area with very little research. And we developed some research goals. The next slide. One of the things that we found when we contacted researchers in Europe, we asked them in this survey in 3 blocks, different items, is that when you ask somebody what is important for the future, people tend to respond, what they are doing. They know better what they are doing. So that's where, so we were getting a lot of responses on air pollution, chemicals, also climate. And this is normal, but it's not good enough when you want to foresee, what do we need for the next 10, 15 years? The next slide. And we also asked the stakeholders. It was very interesting to see the responses we got. And this is from lots of contacts, regional, national, international. And what we were getting back from stakeholders, and these are all types of stakeholders, whatever you can imagine, government, municipalities, NGOs, patients, professionals, industry. We were getting an emphasis, we were telling us we should focus on some of the big issues, climate and wider areas, renewable energies, climate change mitigation. What was constant is that we should promote translation of the research into policies, which is exactly what we want to do with HERA and what the Commission wants us to prepare. And also emphasis on implementation research. Why are we not achieving something? What are the problems? Where are the bottlenecks? So the next slide. So we put all this together, and we prepared an initial interim agenda because the Commission pressed us a lot, and I will show it, but I want to say something else in the meantime. And this is a snapshot from Professor Howard Frumkin's talk, and Howie is a good friend, so I can do this thing. And he had a really fantastic talk in the first webinar, and he was discussing what is planetary health, basically. And he presented a number of concepts for planetary health. And we are following very much, we had been following very much this approach for the HERA report. In the next slide. But the issue that is important, if you are going to prepare a report for priorities for the European Commission, you cannot just present an approach to a problem. You have to present very concrete areas that can be based on an approach. So what we have to do in HERA, and with all these tens and tens of groups that we are working is, and with HEAL that Jenan just presented, is to transform a research approach that includes a lot, a planetary health approach, into specific areas that can be translated into research goals. What the Commission wants is basically a short document that we say, these are the most important things. And if we need research in this and these and these areas, and that's what we're going to do without saying this is first, this is second, this is third. The next slide, please. So just the main message, and I know I'm oversimplifying, but it's easy to remember this thing. When we're talking about main areas for the future, we're talking about the 3 C's, and this is oversimplification. So climate, chemicals, and cities, but everybody can remember 3 C's. It's more complex than that. The next slide. You can think of it as chemicals as stressors, and you can think climate as global and cities as local. And we have to find a way to think about what are the needs for the future by combining them also. We have air pollution as a stressor. Most of the research on air pollution has been done at the local level in cities, and also mechanistic research, which is very, very important. But there is a part of air pollution, and we got a really good webinar in this series on decarbonization. It is global air pollution. It's global pollution. So, and this is what we are trying to capture in HERA. Or take pesticides. Most of the research is done at the local level. How does use of pesticides and exposure to pesticides affects health? But we have to go the other way also. How do pesticides affect the ecosystems and then affect health? So more complex relationship. And this to a large extent is the planetary health approach, or however you want to call it. But it is an approach that tries to put things together, identify the key areas locally, globally, and their interconnections. The next slide. So this is what we presented to the Commission in February 2020, sorry. And we were pressed to present something in a year. We were supposed to present in 3 years, and they asked us to present in 1 year. So we gave them an interim agenda beginning of last year. And basically we have climate, chemicals, and cities, and we express the priorities as actions, because we want to express research, to propose research that will end up into policy. So reduce the effects of climate change and ecological degradation, eliminate environmental exposures harmful to health, and that's not only chemicals. Promote healthy lives in sustainable and inclusive societies, and I'll come back to some of them. And then 2 basically methodological priorities or infrastructures, and health impact. We included health impact assessment because it's extremely important for everything we're talking, planetary health or whatever, and obviously implementation research. And the last priority, to stress that we need to do a different type of research in the future. We cannot continue with the same type of research. The next slide, please. So now we are moving, after we presented that, and it was used actually, which is great. We are now preparing the final version that we will present by the end of the year or beginning next year. And we are making changes. This is draft, so the titles and some of the issues may change. And we are changing, for example, the title of the first goal to include biodiversity loss in the title. And we had in the previous version, planetary health as a sub-research goal. And now we decided, you know, this is more of an approach. It's not a sub-research goal. So we moved it into the introduction. We say much of what we are proposing should follow this type of thinking, the planetary health thinking. So which refers to an applied research, policy-focused, transdisciplinary field, focused on mitigating negative human health impacts of global environmental change and reducing the impacts of human activities on the environment and ecosystem. So what we have been talking in these webinars, and we identify a number of main areas where we should apply this approach. Food systems, global pollution, biodiversity loss, etc. And we connect also with translation, implementation, monitoring, and a number of other issues. The next slide, please. So let me just go through this first research goal, the 6 or 5 priorities we are now evaluating. So we have a first global priority, evaluate the effects of climate change on human health and forecast. And then there's a whole text that I'm not putting. And that's pretty obvious, as is the second one, the mitigation, adaptation, implementation, research on interventions, co-benefits and risk. And again, this comes with a text indicating which are the most important areas here within this sub-priority. And the next slide, please. and the health impacts of biodiversity loss, nature-based solutions, and well-being. And here there's a lot of discussion because we have very little research on biodiversity in connection to human health. We have research on biodiversity in relation to ecosystems, but then we want to make the connection of the biodiversity, ecosystem, human health, and where we have not as much. And so that's why we have to do more. Biological agents were there in our initial report that was finished January 2020. And we realized that we had not stressed enough the connection with infections. And it was the start of the COVID epidemic. So we actually, the Commission asked us to add a separate section on COVID precisely, but I'll come back to that in a minute, and onto biological agents. Food ecosystem services and farming, obviously, we had also a webinar on this. And the issue of the global pollution. We cannot deal with the issues of pollution only at the local level. There are interconnections at the global level. So the next slide, please. And there are other areas of the research goals where planetary health aspects are going. So for infrastructures, we are discussing about a number of issues. You can see them about chemical monitoring, laboratory capacities, new technologies, and the issue of monitoring, following a planetary health approach. The next slide, please. So infections. What is the connection between everything we're talking about, planetary health, and COVID or infections? In this specific slide, this is a slide of deforestation, obviously, in Brazil. In this specific situation, it's Bolsonaro, obviously, the connection. But, I'm talking about more generally. So only if we have a wider approach, we can see the connection between climate change, loss of biodiversity and habitat, human infringements to nature, and coronavirus, or whatever other infectious disease you want of the new emerging diseases. And the Commission asked us, just as the COVID epidemic started, to propose priorities, but they wanted short-term priorities. What do we do with the lockdown, et cetera, et cetera. So, and we said we need the other priorities, the long-term priorities, the wider picture. And that's what we are now proposing. The next slide, please. And this is work that is being coordinated by Delphine Destumier from Montpellier and Franziska Matthias Wissler from Helmholtz in Munich. And we are preparing a number. This is ongoing still work. We're going to finish it in the next few months and propose these areas within the HERO report. And we are making the obvious point, I guess, for this audience, that a major challenge for human, animal, and environmental health is to predict, mitigate, and prevent the emergence and spread of infectious diseases as far as possible, to adapt national and international environmental, agriculture, industrial, societal policies, mitigation, preparedness, and response. And we are in a situation where people are sensitive to these issues and understand them, fortunately. The next one, and we have a number of sub-priorities, and I'm not showing them because we haven't finished this, but they are dealing with issues like better knowledge of the ecology of microorganisms, of the human and ecological factors that prone and accelerate pathogen spillovers and transmission to humans. The issue that if the problems of the pandemics, climate and biodiversity are strongly interconnected, so are the solutions. So that's why nature-based solutions and approaches are important, or the issue of policy options that require transformational changes to reduce pandemic risks. The next slide, please. This is a well-known saying by Max Planck that science advances one funeral at a time, meaning that you frequently have situations in research where you have dogmas prevailing, and it's difficult to change them unless the people who are advocating these dogmas cease to exist. The issue, however, as we have seen in these webinars and today, is that the problems we have to solve are complex. And the EU research structure and policy are also complex. And that's why we need also some of the NGOs that are helping us to find how we have to move. But it's really complex to follow exactly where you have to focus in order to promote research on planetary health. And what is also not easy for those of us who are within big research institutes is that we have one way of approaching things on this local level, and changing this needs a lot of effort, and it takes time. Next slide. But we don't have time. So we really have to go much quicker than, waiting for one funeral at a time. And that's where we are, all of us here. The next slide, please. So I will finish with these messages that fortunately, these issues on global issues, climate and environment have become essential key parts of the Commission, of the European Union, and of Horizon Europe. And planetary health is one of the approaches we really are following when thinking of the research priorities for the European Commission in the next decade. We identify many of the issues that we have been discussing, but we are also aware that there is lack of know-how for many of these issues because there's not as much research developed. And also in our own departments, we tend to follow more traditional environment, climate, and health approaches. And this it will take time to change. And I think that what we are trying to do, and we will do, I mean, it's going very well, the project, is that we will manage to translate for the Commission this more wider approach into specific areas where it can be funded and that will have some kind of tangible result eventually. So, thank you.
Thank you, Manolis. Excellent presentation. I have a question for you while we wait for other questions to come in the chat. ERA is an agenda for the European Commission, but as you have well commented, some of the challenges and some of the solutions of these challenges are global. How should we going broader and not just focusing on in Europe?
By convincing the Commission that some of these issues are not solved locally or regionally, and they have to be solved globally. The European Union is doing quite a lot compared to other parts of the world, to say the truth. This is an issue we have in HERA. I mean, the Commission asks us the priorities for Europe, so we are not developing the priorities for the whole world. We have tried to expand HERA through other mechanisms to the global environment, but HERA necessarily will just propose for the Commission. But some of the things we say are not actions only for Europe. But we are not planning to say to researchers in India, China, Angola, or wherever, what they have to do. They have to develop it on their own. If they want our help, happy to discuss.
Okay, thank you. I'll ask the other panelists to open their cameras and mics because there are questions for them as well, and also questions for all the audience. For all the panelists. Marina, do you want me to read the questions or do you want to take some of them?
Yeah, I can take some.
Okay, just we go one by one if you want.
Yeah. Maybe you start, I will see, because there's
okay.
Some of them have already been answered. I don't know if you have many new questions.
Okay, there's a question for Jenon that has not been answered yet. Jensen, we need a strategy of HEAL to put equity and justice as part of HEAL action.
Thanks. So what is our strategy? It's part of our mission and our strategic plan, and where we have focused, I would say over the last 5 years, is looking at equity between countries and trying to support and build capacity in those countries with the greatest amount of pollution or environmental problems, particularly around air quality, air pollution. That's Poland, that's Serbia, that's Turkey. And the other aspect within the Green Deal, I mean, equity is also equity, intergenerational equity. So looking at how chemicals are not only impacting this generation, but future generation. So that's another aspect of the way we're looking at it and working on it. And I think equity in terms of within the Green Deal would be we're following, and that's one of our priorities, is the whole just transition and the commitment to leave no one behind. So protecting the most vulnerable groups, and also how do we make sure that this transition that we're all talking about here is not only for those with the most. So that's my short answer.
Thank you, Gemma.
You're welcome.
Okay, there is another question for Manolis. Well, first, thank you, Manolis, for an excellent talk. Is ERA also addressing the global pandemic of antimicrobial resistance?
It is in. We have not finished the work on infections. In the area of environment, in fact, infections were not well researched. You were going to the conferences on climate and environment, and we didn't have as much. For climate, there was, because there was a connection with all the story of climate and epidemics in India or in other places. So this is an area among the ones that I was saying that we need more know-how, I think, within the environmental and climate world. And, you know, we got a push with COVID. It became evident to everybody that COVID is an infectious disease, but it's also an environmental disease. So this is among the areas that will be reinforced for sure in the future. We don't have many. You know, I know from, you know, I'm in the journals, and I know what papers we're getting. We're not getting lots of infections and environment. We're not. It will take some time to develop.
Okay, then we have a nice question from Professor Anto, which is directed to all, and it's called, how do you imagine the evolution of planetary health as an emerging field in the future? I think this is a very relevant question, and it's actually the main reason why we are all here today, I think. So so who starts answering to this? Maria, maybe could you, Maria Westerbosch?
Sure. Planetary health is closely connected to human health and all life on Earth. So it's very relevant, I would say. And it's also connected to climate change. So all these issues together is making it very, very urgent. I would say if we want to keep this planet worth to live on for the next generation, we have little time there's little time left, and we need to hurry and work our butts off to do the best and leave a better world behind us.
Thank you. We have been discussing here in Finland, and especially here in the region, that it could also be so that, you know, planetary health related issues and climate change, and so they are found very interesting by the academics and the upper classes and the higher income groups. But how do we actually manage to put this agenda among working people, among normal people who are going to the everyday work and who are being troubled at least for the time being from a very variety of things? I mean, income, salaries, how to manage with their children nowadays, because due to this global pandemic, which is likely to last for some time. And so how do we manage to put this agenda towards or as a cross-cutting issue to all groups of people, not only the high income groups?
Well, we are capable of changing very huge threats, and we did it before in the world when it's concerning human health. So as soon as we know that our babies in the womb already are affected, then we are willing to make a difference. If we know that the costs for our health are much bigger because of the threats of the planet, we will change our behavior, and industry will change is adding chemicals to all kind of stuff like plastics. I always talk plastic. So when human health is at stake, things will change, and then everybody will respond. Also, people with less income, and everywhere in the world, also in Africa, and especially because we transport all our dump and our e-waste to Africa, a lot of it. So we are threatening that continent directly here in the north. So, and we should be ashamed, I must say.
Thank you. Jaron wants to ask.
Also, Manolis rose his hand.
Okay.
If I could add to this, I think it's not only a matter of socioeconomic differences and attitudes within societies. It is what's happening in the whole world. One of the dominant ideologies is that we basically care about the economy, and it's true that people who haven't visited third world countries, it's difficult to talk about the situation that people are living in third world countries, but we have the way of changing is that we are seeing the effects of climate change. You don't have to wait many years. You see them with extreme events. We see some of the effects. The extreme events are here. And this has, I think, this is making a change. Similarly as what it made a change in the EU, is making a change in the US, and it will make a change all over. And the argument that we have to expand economically continuously, will stop functioning at some point in time. But it needs a lot of work to change this dominant ideology, obviously.
Jaron, I think you raised your hand.
Okay, good. I just want to make sure.
Yeah,
yes, thanks. Very good interventions by Maria and Manolis. And I would add to that, what I found as well is that you can't ask people who don't have, even if they're concerned, they find out this product might reduce their fertility and then they realize now they can't have kids. They can't change their behavior if they don't have the means. So I think one of the things we really have to look at is making the true cost of products, and also making the polluter pays, so that the healthiest option is available to all. Otherwise, how are we going to ask people with low incomes to make those changes or to eat organic? I think that's a really important is internalizing these external costs to our health in the product. And I also think we need, along the lines of what Manolis has said, is, our economic is one part of it, but we also need to say, well, we're going to stop subsidizing fossil fuel, and companies. And that is really important. If we don't change that, and that's what a lot of us are working on, and investments in those companies, then how are we going to transition? Because fossil fuels are not just about climate change and air pollution. They're also the basis of the petrol that's making our chemicals and our plastic products and our disposable economy. So I think we have to look at investments, and we have to, as the EU, is say, okay, we are not going to put our money into this type of trajectory, and things can change quite quickly when the money is no longer there. That's the point I'd like to make.
I have an example here from my own city, Lahti. I was born in this city where I'm working nowadays, and I left the city 37 years ago and returned 2 years back. And we are a city where there is forest, and this is a ski sports city, and there is lakes, and there is everything possible you could go to. And it used to be a very sporty and a very healthy city. Then we had the Great Depression of 90s, and there was a really hit very hard this region in Finland. Now when I return, I see that I return to a totally different city, and people are not that sport-oriented anymore. They are not living any more healthy and so on. It was even to myself, it was really, big shock, because we have all the possibilities here, and we have all the cheap possibilities here, because it's practically free of charge to go out skiing or whatever. And still our young people are not, they are not feeling well, and they are unemployed, and they don't know the ways how to make use of all of these resources we have. And even here, it's mainly the high-income people, the academics, who are interested in issues such as planetary health and exercising and eating safely and so on. So it's not really that easy, even if we know it's not that really easy to make the change if one's life is full of troubles and burdens and financial burdens and worry of relatives and so on. So I'm constantly thinking how we can address these people who are burdened already to make the changes in their life. That's why I asked the question.
Thank you. If you don't want to add something else, or you have any burning comment, I think it's time that we wrap up the session. I think one of the key messages that I take from the session is the importance of involving different stakeholders, NGOs, researchers, policymakers, and the broad society in trying hard to solve the current challenges we face. And the other message that I take from the session of today is the urgency to act. We cannot wait any longer. We see that the challenges we face are important, and there is no time to lose. So I'd like to finish with a call to action for planetary health. So Marina, if you want to add something.
No, I just wanted to thank all of you. It's been very nice discussion and very, very lively discussion also in the chat. And I like also very much that, different countries are participating in this and so on. So I'm actually very happy to see the movements that have been actually going on after the Helsinki Declaration. Of course, Finland didn't start this planetary health movement, that is for sure, but we did our own things there, and we put the Helsinki Declaration there and so. But I'm very interested to see that very much has actually happened in 2 years now, and it's once we get this rolling and we get the critical mass of newly thinking people, we get more involvement and we get clear messages, as also Jenon was addressing today, clear messages involving all population and also all stakeholders, and especially the political decision makers, but also at local level, because people are living in regions and in communities. If we don't manage to start the movement from here, from the communities and the regions, then actually nothing really happens, no matter how much we talk at national level. So I think all of these issues were emphasized very nicely today. So I'm very happy that we had the opportunity to participate in this. And actually, I welcome all of you to the November meeting, in the Lahti meeting in either here in Lahti, which would be the ideal thing, or then in the webinar. So hope to see all of you there, and then we launch also the Lahti plan.
Well, and with these final words, we have completed the series of 5 webinars devoted to strengthening the field on planetary health within Europe. On behalf of the 3 organizing institutions, ISGlobal, LSHTM, Center on Climate Change and Planetary Health, and the Finnish Institute on Health and Welfare, we thank you all, the speakers that have been contributing not only to this session, but to the previous 5 webinars, and obviously the audience for participating and posing very nice and very clever questions. Some of them have not been able to be answered today. We'll try to find a way to give you an answer. We also want to thank Ariadna Moreno, Mari Carmen Garcia, and Aleix Cabrera for the great assistance. Without them, these seminars would have not been possible for sure. And well, just to finish, remind you that all the sessions are recorded and will be available in the website of ISGlobal. Well, thank you very much. It's been an incredible experience having these seminars.